we should be like the Philippines. I have been preaching this for the last 5 years. The Philippines is very clear. They're training people for export. They train nurses for export. They don't care.
Mrs. Dinham Spencer.
Yes, ma'am.
If yours right now, you seem to be the standard by which the industry ought to be judged.
It is.
Why can't you get certified, accredited, and I'm really trying to understand. I'm the oldest in here. So
I've been registered by the Ministry of Education.
Yeah.
I have been registered by the Jamaica Tertiary Education Commission. As a matter of fact, I've finished my 2 years and I'm in the process now of registering, getting re-registered for 5 years. It's a process. I'm in the middle of that process to send them documents and and they come and inspect. That I have gone through that journey. Where I am seeing challenges is because we are not in an environment. For instance, as I said, my overseas partners, the people that I'm looking for to take my students, they're always questioning. So what is a patient care assistant? For instance, we have a patient care assistant. Do they go through so and so? So I have to say, yes, I'm following your standard, right? Because I cannot tell them that this government has
no standard.
But because you see, they can go on the Florida board and they can see it. They can go on the Canadian system and it's there. You don't need to ask any question. When they go to our government websites, they can't find anything. And then they don't believe me. Okay, all right, let's put it this way. When I was dealing with the Canadians to get the Canadian license to do the personal support worker program, behind my back, the NACC Director of Education, she's in New Brunswick, she goes to the government website and she's looking for Department of Health because she's looking for all the things that gives her the assurance that I'm who I say I am.
Right.
She couldn't find it. She came back to me and she said, Beverley, I don't understand. Where do I find this thing? And I'm saying, this is when I call Carolyn and I'm saying, what do I don't know what to do. We don't have it. And those people have it, and the same thing for the Royal College of Nursing.
Yes.
You go to their website, boom, boom, boom. You see everything. You know how where you fit in.
What is interesting?
I don't have that.
Our health minister has talked about exporting.
Right.
I went back and I found an article from 2016 where we had the UTEC president then, Professor Stephen Vassiani, talking about need to export nurses and so on. But I don't understand if the government is talking about this and key people in the society and leadership positions in academics and so on are talking about it. But then the government itself does not have the architecture and the system to guarantee that those who it is saying would come from Jamaica, where are they on the issues of standards and and how can the system give credibility to the training that people are come, such that the official from Canada could have gone onto the system and seen that the government has this thing. I suppose it goes back to Dr. Haley, sort of going around and around and
the demand. Let me tell you how exciting the demand is. Let's be positive. The demand. I just arrived back in Jamaica on Monday night from the conference that the NACC had in Ottawa. And it was a conference of over 400 career colleges. They call them career colleges. Career colleges are different from the universities. Career colleges deal with skills, profession, and moving fast. You don't have the summer to go to Europe and dilly-dally. You go in, and if it's 12 months, it's 12 months. If it's 16 months, it's 16 months straight. And it's dealing with usually older clientele. They were discussing the demand in Canada for health workers as one of the areas of discussion. In Ontario alone, they have over 4,000 vacancies for personal support workers / nursing assistants. That's only one province. You have probably about 35,000 vacancies right now. Canada have to be closing down nursing homes. They don't have enough people.
That's true.
And they are paying up to between, if you want a PSW in Toronto right now, you have to be prepared to pay $25 an hour. You can't get that. So the demand in Canada is high. The government has now, they call it the care economy.
Yes.
The care economy. And they have a minister that is in charge of senior care. It is so important. The UK has a vacancy rate of over, it was about 40,000, it's down to 25,000. They have pumped in, I think it was somewhere about $40 million over the next 5 years to import personnel to look after people. The US, you have alone in Florida, the vacancy rate is about 5,000 or 6,000.
In Florida.
In Florida. What I'm saying is, we should be like the Philippines. I have been preaching this for the last 5 years. The Philippines is very clear. They're training people for export. They train nurses for export. They don't care. They have the schools, the government has the systems, and they are pumping out those people. And the returns to the Philippines is phenomenal. Millions, billions of dollars going back. I am just saying, I want Jamaica to be another Philippines. Because one, we are nicer. Two, we are alive, and we make the patients in the nursing homes feel alive. We cook rice and peas and take for them in the nursing. No, I mean, we Jamaicans are popular.
Yeah.
We Jamaicanize them.
Yes.
And when I was there last week, several persons came up to me and said, "Oh, my mother loved her Jamaican PSW. How can we get some more?"
Yeah.
If I took 10 PSWs with me to Canada last week,
None come back.
not one of them would have come back.